Hello, welcome to the Stellalife Innovator series. I'm Liz Lundry, and today I have the pleasure of speaking with Dr. Ehab Moussa. Dr. Moussa maintains a full-time private practice in New Orleans, Louisiana, focusing on periodontics, dental implant surgery, and prosthetics. And teaching is a passion for Dr. Moussa. He's lectured nationally and internationally on many topics, including hard and soft tissue augmentation around implants, periodontal plastic surgery, and partial extraction therapy. Thank you for joining us today, Dr. Moussa.
Thank you so much for having me, Liz. It's a pleasure to be here with you, and thank you again for this kind opportunity.
Oh, you're very welcome. I know how busy you are, so thank you for your time. I know you're
Of
on the
course.
road, so I'm so happy you made some time for us today. So just talking about what you do, tell us about your philosophy of periodontal treatment and implant placement in your practice and in your courses.
Well, that's a great question, and I feel it's a question that can be answered in many different forms. But I'll go ahead and I'll talk to you about how I approach periodontal implant surgery nowadays, treating my patients. And for me, really, I'm a clinician that likes to do everything. I don't only do full arch implant dentistry. I don't only do hard and soft tissue augmentation. No, up till this day, we perform procedures that we save teeth in. So periodontics is still a big part of my practice, saving teeth. Regenerative procedures around teeth, but also regenerative procedures for implants, meaning hard and soft tissue augmentation for patients that are partially edentulous, missing a few teeth with large alveolar defects. And at the same time, we do manage a large part of my practice is the terminal dentition patients and patients coming in for full arch implant treatment. And we do have a digital lab that helps us in managing these patients with immediate loading, whether it be FP1, FP2, or FP3 type of prosthetics. But this is basically our philosophy, and my philosophy is, not everything is a nail, and my only tool is not a hammer.
Yeah.
And so when teeth can be saved, we save them. We really put the patient first. Based on the patient's clinical condition, based on the patient's systemic condition. We offer different options, and basically I tell the patient what I would do if I were them. And that's pretty much how I go about doing dentistry in my practice.
Yeah.
You asked about how we teach it, and that's really something that I really enjoy, and teaching is half the fun for me. Just as much as I enjoy doing clinical dentistry, I enjoy teaching. And really the thing I would say that sets our teaching apart is the detail level and the step-by-step protocols that we go about doing these procedures with. And so we essentially we're treating or teaching these procedures with, and essentially we go with, when we do a hard tissue course or a soft tissue course, we talk about didactics first. We talked about the basics for performing these procedures. And then we talk about techniques. And when we talk about techniques, we can go into these techniques in a step-by-step fashion. And then obviously we supplement that with hands-on training as well.
Right. That's great. So, as more dentists are placing implants, what do you think is important for them to understand about bone augmentation and soft tissue management? You're quite the expert with this.
Thank you. Well, that's a great question. There's a lot of people a lot of dentists that want to place implants nowadays, and I think that's a great thing. But placing implants is more than just placing screws into a piece of bone. I feel one of the biggest challenges that we have in implant dentistry now is the rise in peri-implant disease. And a large cause of the rise of peri-implant disease is implants being placed with insufficient knowledge of hard and soft tissue management. So implants that are placed with insufficient quality or quantity of bone or of soft tissue. And in my opinion, dentists who want to place implants should really put an effort into being educated on hard and soft tissue principles. And it doesn't always have to be, big and fancy hard tissue procedures or soft tissue procedures. It can be as simple as knowing where to place your incision, how to move keratinized gingiva from the palate towards the buccal aspect around your implants. And so, in my opinion, um, dentists who are starting to place implants, who want to place implants, should be educated in the hard and soft tissue management principles, and also should be knowledgeable on the complications that may arise from any procedure being performed. So a big thing for me, I'm not going to attempt a procedure unless I know how to manage a complication that can arise from this procedure. And so again, knowledge in hard tissue, soft tissue augmentation, knowledge in other things like partial extraction therapy on how to maintain the bone and the tissue architecture that's already there, are really great things to incorporate in your daily implant practice that will increase your success and therefore improve patient experience and success on the long term.
Right. I really like when you're talking earlier about your approach, looking at the whole body, looking at any systemic risk factors. And then if doctors are doing this type of procedures, they have to really have the imaging as well, and
Absolutely.
we have to keep up with our education because there are so many developments and new products and different ways of really being more successful. But it's not enough to just take a couple of courses and just dive ahead. So we really
Absolutely.
need to have the full spectrum of knowledge to, again, avoid these complications. But yeah, that's the way to go, of course. So what sort of advice do you have to offer doctors considering starting to place implants, in addition to getting really well-rounded with their education and their base of knowledge?
Well, it doesn't happen overnight, and through our academy, EM Academy, we offer a lot of hands-on courses, and a lot of people will look at this, and a lot of people will be focused on the fact, well, I want to go and do a live patient course because that's how I'm going to learn the best. And it's true to a certain extent, but in my opinion, if you want to learn something, you got to take it step by step. Maybe get an online course first, understand how the techniques are being performed, learn the steps. Come take a hands-on course where we spend one day on the didactic knowledge, the second day on the hands-on experience, and try this on an animal model. Try raising a partial thickness flap, try stabilizing a bone block, try harvesting a bone block. You will gain a lot of knowledge that will allow you to understand these techniques. Then you can expand by perhaps going to take a live patient course or seeking out mentoring in your practice. But in my opinion, it's continuing education. It's nonstop. It's something that we all have to continuously be doing to not just get better, but even maintain our level of expertise and God-given talent. So I'm talking to you today here, and I'm in Denver attending a continuing education myself, just to keep up with the knowledge on the business aspect of things. And so, like I said, just keeping at it. We offer different basic and advanced courses. We offer also, we will be offering live patient courses soon. So in my opinion, it's just a step-by-step process, and practice makes perfect, like anything else.
That's right. And I go to a lot of courses. And so doctors that have been placing implants for, many, many years, will talk about their failures because sometimes things happen and we
Exactly.
learn from each other. So as you were mentioning, having a local mentor is great. And of course, you mentor your attendees and your students too. But at the end of the day, to give a patient a functioning mouth and to have them have a happy smile, you're really, I mean, that's the best thing you can give a patient, I think. And the
Absolutely.
satisfaction with that and the great feeling that gives you, it makes all that study and hard work and the investment in your education worthwhile. I think that's why we do it. So, at Stellalife, our mission is to improve lives, and you are absolutely doing that. I know you use Stellalife in your practice as well to, help with getting those nice predictable results and having the patients comfortable. So, that's been part of your journey too.
I absolutely do, and I have to tell you that my experience with Stellalife has really been outstanding. Um, you know, I'm not one of those people that goes out and makes, extreme claims of, that, I've done clinical studies in my office and done all that, but I can tell you just from my personal experience, incorporating Stellalife in these challenging hard and soft tissue augmentation cases, where initial healing and having the body really give us its best healing potential becomes really, really so important. And if you don't mind, I can share a quick case with you here that kind of demonstrates exactly what I'm talking about. So this was a patient, this was one of those very, very challenging cases, and this was a case that I had initial failure in a large bone augmentation procedure. And in these cases, a lot of times, especially in bone augmentation, if you get a failure, you're going to end up worse than you initially started. And this is what you see here. This was the condition, and we're going in to perform a bone graft. You see the scar tissue, you see the lack of flexibility of those tissues, and then we go in, and this is the defect. It's a huge vertical bone defect, and there's a lot of bone missing, probably maybe 7 millimeters of bone height, 3 teeth missing in a row. And so we're going to go to use autogenous bone here. So we're using both of this patient's ramuses. And so we're giving it, again, the best biologic potential that we can get. And so we want to also allow the host to give us the best healing potential that's also possible. And so this is autogenous bone. We follow correct technique and correct principles of application, which is something that, I don't care what you're going to use in your surgeries. If you don't follow correct technique and principles, then you cannot be successful. But everything is stabilized. And I want you to know the amount of bone that we're putting in there and the amount of soft tissue release that we have to make to cover all that bone. And you can see how much struggling or how struggling I am here to close my flaps over the bone graft that I've placed. And there's a little bit of tension on the flaps. These are not completely tension-free. And so this was one of my cases where I've utilized Stellalife products after the initial failure. So this was the first surgery that the patient started using it. And you can see the healing that follows at about 2 weeks. And
Beautiful.
this, in my opinion, is really, really excellent healing in the eyes of someone who does these procedures and have been doing them for a few years on a regular basis. This is as good as it gets in terms of early healing after a bone graft like this, honestly. But then you can see that we follow up, and every single procedure that I followed up on this patient, we kept using Stellalife, and you can see here is the soft tissue management phase, where we use a vestibuloplasty to get rid of the mucosa, and then we're doing multiple free soft tissue grafts at the same time. And here you can see a free gingival graft at the top also being placed. And this is the final soft tissue healing that we were able to get. And so these are cases where I feel that really Stellalife, there is a factor that is being added to get the best healing potential out of this particular patient. And so again, these are the cases where I feel that Stellalife really, really helps in the healing, as you saw in the previous case.
That's great. Wonderful. Looking at that case, I mean, that's challenging. And with all that you did, the patient would have a lot of opportunity for discomfort, so having Stellalife there, I've had 2 perio surgeries myself with massive grafting back in December. So I know what that is like, and having donor sites, on the palate. And it does make a big difference. But the challenge for you there, it was a challenging case anyway, but it's also in the aesthetic zone. So, to get that and nail that down and make it look beautiful, that's just incredible. So congratulations on all that you're doing. And you're just a wealth of knowledge. So I hope everybody can learn more from Dr. Moussa, and really want to thank you for joining us today and sharing what you do. So all the best to you with your travels and your courses. And I know you have some upcoming this year, so we'll make sure everyone knows about those. And for everybody else, I want to just thank you all for joining us today. And enjoy yourselves, whatever you're doing, and let's all keep learning and stay well. Thank you, everybody. See you next time.